Hello today, my name is Luke Hensley and I intend to run as an independent in the next federal election for the electorate of Corio. I've spoken about wanting to end poverty in Australia, and that mostly comes down to ensuring people have enough money to financially care for themselves and their families. I don't think that's enough though. I see a need for much greater social welfare reforms, specifically in relation to health, education and housing. In Australia, we have Medicare, which is a lesser form of universal healthcare. It doesn't cover everything, and there are gaps in the things it does cover. The strength of Medicare is its universality. Everyone is entitled to it. When everyone benefits from something, no one will let anyone take it away from us. Even if you have private coverage and don't use it, you still won't let any government take Medicare away. This is why I pushed for universality in these policies: universal healthcare, universal public education, and universal social housing. We need to expand Medicare into a national healthcare system, one with universal coverage of everything, including dental and mental healthcare, a healthcare system that doesn't have gaps and doesn't make you choose between your health and your finances. Just last week, I had to get a biopsy on a suspicious spot on my leg. It cost me $150, and Medicare gave me a rebate of only $46.20. I'm out a little over $100 out of pocket while I'm on job seeker poverty. It's not enough to increase the job seeker rate if a medical bill can put you back in the red. The pathology report was clear, by the way, if you were concerned. Healthcare should be free at the point of service and publicly funded and properly funded. It should be independently audited to determine operational costs, including staffing, maintenance, equipment and facility upgrades, etc., with discretionary spending for unforeseeable events, such as a pandemic. This would form a baseline minimum for funding that no government could cut or spend less than, ensuring a fully functioning healthcare system that leaves no Australian behind. Another part of leaving no Australian behind is having a world-class universal public education system covering primary, secondary and tertiary education. Our public education system needs to be expanded and infrastructure upgraded to close the divide between public and private and city and country, to put an end to the systemic disadvantage that exists between the haves and the have-nots, and ensure equality of opportunity for all. Our education system should focus on the best outcomes for students, both academically and for personal growth and welfare. We should encourage a love of learning and put in places systems to continually provide access to knowledge and institutions of education. Finally, as part of ending poverty forever, I want to end homelessness in Australia. Housing should be considered a human right. However, our legislation favours housing more as an investment. I want to expand public housing into a universal social housing program to ensure that everyone in Australia has a roof over their heads. I also want to legislate a higher standard quality of housing with modernised heating, cooling, insulation and appliances to ensure our housing is more resilient to the effects of climate change, and introduce rent control measures to ensure greater access and affordability to housing. Housing insecurity affects your health and it affects your education. These are issues treated separately, but they all compound on each other. I've had my own issues with housing insecurity. I lost a unit I was renting a couple of years ago when a storm partially ripped the roof off. I was made homeless. These aren't issues I'm looking at from the outside. I have lived experience with this. I think that's something we need more of in government, and that's part of why I'm putting myself forward to be part of that change. I hope you're well, and I thank you for your time.